2.
Hello everyone, it's Dr. Vidal and we are back with Thursday tips. So unfortunately on Tuesday I was late here in the clinic, so wasn't able to join you, but here we are, Thursday tips. So thank you for joining. And today we're going to continue our series of what to expect. Today I'm going to be talking about a shorter topic so we have more time for your questions. So it's about Morpheus8. So I'm going to talk a little bit about BodyTite and FaceTite too, but focus mainly in the what to expect of the Morpheus8 treatment. What is this? Okay, so InMode is a company and it's a machine. I'm going to show you here like a little picture of what the machine actually looks like, and I have a video of BodyTite that I'm talking with the machine, but this is basically the InMode machine. And with this machine, you can connect different devices, and these are like some of the different devices that you can connect to the machine, but the ones that we have here available. And they administer radio frequency energy, okay? What is the difference? The difference is the depth of penetration. So BodyTite and FaceTite are a little bit more invasive in terms of it has to have an incision, and it's combined with liposuction because we use the same incisions as the liposuction. And basically I'll show you here a picture of what the device actually looks like. So this is the FaceTite and this is the BodyTite. It's basically like a small cannula, and this little cannula is the one that goes on the inside through the incision, and then it has this probe on the outside that this is what's transmitting the energy, okay, the radio frequency energy, and that causes radio frequency assisted lipolysis or breakup of the fat, and that energy causes collagen remodeling, skin tightening, and improvement of the skin quality. So basically this is like a picture of the device on the side view. You can see like the little black line is the cannula that's going to go on the inside of the body, and this is a picture like a little diagram of what it looks like. This is the skin, the yellow part is like the fat, and then that cannula goes on the inside and that probe is administering the energy. The good thing about this device is that it's measuring the temperature, okay? Then it's important because we don't want to burn the skin and burn the subcutaneous fat. We want to cause a control scarring of the tissue and the subdermal, epidermal, and subcutaneous layers to create a contraction, but not that much to create scarring fibrosis, okay? So that's why this machine is so good, because it's measuring constantly the pressure, and it has a back system and an alarm system that you're monitoring all the time to make sure that you're not going into dangerous temperatures, okay? So the difference between these two is basically the size, as you can see here. The FaceTite is used mainly for the shin area. Very good adjunct for shin lipo, okay? Majority of my patients, I do recommend combining, if they're doing shin lipo, to combine it with FaceTite. The reason for that is the skin in the shin area is very thin, usually does not contract very well. So doing just shin lipo is gonna create very saggy, like turkey neck. Not good. So the FaceTite helps contract and get a better contour. It is not equivalent to a neck lift, okay? So if you do have severe skin laxity, it's better to do a neck lift. Similar in a way, if you have severe skin laxity in the belly, it's better to do the tummy tuck. So same thing here, you know, these devices are great, but if we use them for the correct indications, mild to moderate skin laxity. If we are pushing the envelope, trying to create massive contraction from it and expecting results that are more of a facelift, neck lift result, we're not going to see it with this device, okay? But if you have good managing your expectations and you have good skin quality, it's moderate to severe, then it does give very, very good results, okay? The BodyTite, like same, but longer and a little bit thicker on the actual device. Why? Because the thickness of the skin is different in the neck and in the belly, okay? So this is the BodyTite FaceTite. What's the difference with Morpheus? So Morpheus is a less invasive, minimally invasive alternative to do it here in the clinic. It is great for the face area, but it also very, very good for the body, So this is here The device looks like this one here, okay? So different colors is for the different thicknesses, okay? And here is like a diagram, okay? So the device has like, the tip of the device has a little cartridge with multiple needles, and those needles are the ones that are going to be penetrating the skin. So this works on a subcutaneous layer. So we have the skin, we have the dermis, which is the layer of the skin just below, and we have the fat layer of, or subcutaneous layer, okay? And this is the skin or epidermis, and here is the dermis, or the layer, the thick layer of the skin. The BodyTite FaceTite works in this layer, and the Morpheus works in the skin and dermis, okay? So a little bit more superficial, okay? So if you can see, depending on the device that we're using, for if it's the face or it's the body, the thickness changes, or the needle penetration changes, because we want to get to that dermis, okay? So the millimeters that is going through and administering the energy, it's different, okay? So that's why the change in color, okay, for the body and the face. There's also a resurfacing option that the needle is like less to target the epidermis, or the most superficial layer, for resurfacing and getting those old cellular, old dead cells in the superficial of the skin peel off and get a better contour and better skin quality afterwards, okay? So why is it so good? So it is very good for fine lines. It's very good for skin texture, skin quality, very good for skin tightening, okay? And also superficial scars like acne scars and other types of very superficial scars, okay? Because of that resurfacing capability, okay? I'm gonna focus on the what to expect, and if you've seen a lot other videos that I've done on the what to expect series, is about patient experience, okay? So what things to expect after this procedure. And why am I the perfect person to talk about this? Not only because I'm a physician, plastic surgeon doing the Morpheus, but because I did Morpheus, okay? So I can tell you what to expect from like myself. I experienced this, okay? So treatment itself, not very painful at all, okay? If you had laser, like hair removal, laser treatment, very similar. There are areas that are a little bit more sensitive, and other areas that you don't even feel it. I think the areas that are, for me specifically, were more sensitive around the jawline, around the temple, where the skin is thinner. I felt it the most, but it wasn't painful. It was just like a little bit discomfort, and you just, communicate with your provider, give me a second, and you just, and tolerate it very well. The procedure itself is like 30 minutes or less, depending on the areas. I did my face and my neck, so not very long. What takes the longest is actually the numbing cream, okay? So I put numbing medication, numbing lidocaine topically. So that takes about 30 minutes to 45 minutes for it to settle and get numbing on the skin. So that's, plan ahead. So you'll be here for like an hour and a half, because by the time that you come in, you get your consents, your numbing cream, pictures, treatment, and then you go. It's like gonna be like an hour and a half, okay? So treatment itself, like afterwards, I was very red, but I get very red by any treatment. My skin is very sensitive, but that initial redness lasted for like an hour or two, and afterwards, mostly like little dots, maybe, like if you looked at me very closely, and you could tell for the first 24 to 48 hours. It is important that you don't apply makeup, okay, for the first 3 days, okay? So you can apply, there's very good products that we're gonna be sending you with here for restoration afterwards, but it's not good to apply other creams or topical products that you use on a daily basis, because remember, the skin had been traumatized with needles, and those openings last for about 48 to 72 hours to close. and you're at risk of infection. So it's important your post-op or post-treatment care, and we'll definitely give it to you and orient you on what is the things that the specific ointments and creams that you need to use, but specifically makeup, avoid it for 72 hours. So plan ahead. Obviously, if you have an event, if you have something, try to do it before, like a week at least before. So you may experience some swelling, you may experience some irritation, redness for the first week. So if it's a big event, at least 2 weeks before, to give plenty of time for the skin to be perfect for that event. Okay. The other thing that's important is sun exposure. Okay. Whenever we have trauma to the skin goes through a healing process, and that healing process attracts more sunlight, and the melanocytes are more sensitive, and you can get hyperpigmentation or dark spots. Okay, so you should be like, when you're coming for your treatment, plan to have either like a hat or cover yourself, and don't plan to go to the beach or anything like that for 2 weeks to have the skin healed before exposing yourself to sunlight. Okay, the irritation, like I mentioned, the first 2 to 3 days, but it depends. It may be a little bit longer, but the biggest irritation is after it's for those 2 to 3 days. After the first 3 days, you can put makeup, and it's pretty very, very easily hidden with the makeup. And the important part is the results take time. Okay, so these treatments are creating that controlled scar and that collagen formation. So it's not overnight. It's not like the fillers that you see right away. This takes time. So at least 3 treatments should be done about 4 to 6 weeks apart. So you're gonna be on treatments for at least 3 to 4 months. Okay, so you take your first one, you wait 4 to 6, second one 4 to 6 weeks, third one, and after that third one, you need to wait like 4 to 6 weeks to see a final result. Okay, so that remodeling takes time, and that's obviously the hardest part, being patient and waiting for the result. But I've seen a great improvement. I'll be showing my before and afters. I think my main concerns were around my mouth, my fine lines, and my neck, and I saw great results with the Morpheus8. So I do recommend it for all of you that are looking for better quality of the skin, improving those fine lines, and skin tightening. Okay, I'll take some questions now if you guys have it.
Yes. Can you talk about the incisions? I'm gonna be getting arm sleeve, and I'm just scared that I'm gonna have a big scar. Can we make it straight as soon as possible?
Of course. I never try to make a curved scar. Okay, that's never the goal. The goal is to make it as thin, as straight as possible, hidden in areas where we can easily hide it with clothing. But everybody's different. Everybody heals differently, and your post-op care is extremely important. Okay, so what are the things that we do on the arm lift specifically, since you are asking about the arm lift or brachioplasty procedure? I try to make this scar in an area that if you are holding your hand like this, it's like in the bottom part and not in the front. That is good in the front and on the side, but you can still see it on the back. Okay, an arm incision is never going to be completely hidden because our arm turns in a 270 degree. Okay, so it's especially if you're like this, you're going to see it on the back, but in the front, and when you're holding your arm against you, you're not going to be able to see it. Okay, what things we can do afterwards to improve the scarring? One is tension. So anything that increases tension will create more force in the healing process, getting the scar to heal thicker and wider. Okay, so decreasing swelling, elevating your arms, sleeping with a pillow underneath, compression garments afterwards are extremely important. Minimize movement as much as possible. It is impossible to not move your arms because you have to eat, you have to wash your face, but try to keep your elbows close to your body and minimize those movements as much as possible for the first few weeks is very important. And then scar treatment, okay? So silicone-based scar products are extremely important to start 2 weeks and be very religious with them. So it's similar to this, that you're not gonna see a result right away. You have to be consistent and use them for at least 3 to 6 months routinely to see a result.
Can I go back to wearing leggings at 6 weeks post-op BBL?
Yes, so 6 weeks, leggings is okay. Jeans especially, or if the leggings are very tight in the waist area by 6 weeks, you may still be a bit swollen, and you may create creases. So if your leggings are very tight in the waist or jeans, you should wait 3 months. But if it's okay, if it's tight but not creating that crease, is fine that you wear it at 6 weeks.
If I had a mid-facelift with fat at under the eye a year ago, can I have the Morpheus treatment? Will it dissolve the fat that was put in the face?
Very good question. It may create some changes in the fat, but like I mentioned, the Morpheus8, especially in those areas, can be then modified so the penetration is less. And for those areas where you have the fat grafted in the mid face, it's focused more on the skin and dermis and not in the fat. So we can put it more superficial to avoid penetration into the fat and try to prevent that.
An extended tummy tuck, can incisions be as straight as possible?
Same as before. I never try to make them, I try to make them as straight as possible. In an extended tummy tuck though, when you go past the hip, it's going up, it's better to go down again, because if not, that scar is going to continue up and it's going to be visible in a bathing suit. So that's why when you see in pictures of an extended, sometimes it looks like this, down in the middle and then kind of on the sides like this, belly button here and then the legs here. It's better to kind of curve it that way, because if not, this scar is going to continue up and the bathing suit is going to lie here and you're going to see that end of the scar. Okay, so it all depends on your anatomy, it all depends in where your folds are, but that's better to hide it here than when you're wearing your bikini. You can hide that scar there.
How long until you can use your arms after an arm lift? I'm a mom of 3 little boys.
So I would advise you to plan help for the first 6 weeks. Okay, so I ask you not to lift anything more than 10 pounds for the first 6 weeks. After 6 weeks, you're able to start range of motion and picking up. So those first 6 weeks, you're gonna need help with those 3 beautiful boys.
And how long after body surgery can you start the Morpheus to help the scarring process?
The scar, I wait 3 months, okay? So we want that scar to be completely matured prior to adding any energy to it.
Okay. The patient that asked for the line in the tummy tuck says, okay, thank you so much, because I want to wear a bikini.
You see? Thinking of that.
Hey, Dr. V, is IV therapy necessary after surgery?
Not necessary, but there are some patients that find it beneficial. The important thing about IV therapies is when you give yourself an IV, a liter, 500 cc's, your body metabolizes that very quickly. So you're gonna feel better fast, but also you're gonna pee it very fast, okay? It's gonna go through your kidneys and you're gonna pee that extra fluid very fast. So you still need to be drinking the 1 gallon of fluid a day for your hydration, because you're gonna flush the IV very quickly, but you still need your system to be hydrated with the PO intake, the oral intake.
How long after weight surgery for a tummy tuck?
For what surgery?
After A weight loss surgery.
Weight loss, okay. So after bariatric weight loss surgery, at least 1 year, okay. And the other important thing is you have to be stable in your weight, in your goal weight for at least 6 months, okay. So if your surgery was a year ago, but you're still losing weight, you should still wait, okay. The important part of that is that some people, after they reach their goal weight, they fluctuate before finding that stability on the weight. And it's important that you're in a stable weight so you can maintain your results in the long run.
This is in Spanglish. I love it. It says,
Mi
Doctora.
idioma,
Yeah, Spanish, como hablamos aquí. Doctora, how tight should the faja be? Says, I can say that word because it's should on hips and butt. I feel like I'm super tight. I don't understand, sorry.
Okay, no, but I think I'm getting it. So, and it's a very common concern with BBLs. People are always very concerned that the faja is being too tight in the buttock and hip area, and then they're gonna lose the fat. So you have to get a faja that it's built for a BBL, and the buttock part is like more meshed. Okay, it's not high like the same fabric as the one in the body. Okay. If it's a BBL faja, it's okay. Having some compression is actually good for the swelling in that area. Obviously not sitting on it or putting external pressure, but the compression on the faja, it's okay and it's not gonna kill your fat. Awesome, you guys. Hope that you guys learned the Morpheus8 and my experience with Morpheus8. I'll be showing my before and after so you guys can witness what it did with my face. And if you're interested, give us a call. It's very easy to schedule. We have 2 great providers doing the Morpheus treatments, so very easy to schedule with our girls. And like I said, very minimal downtime and very tolerable. Hope you guys enjoyed, and I'll see you Tuesday next week. Tuesday tips. I'll see you guys. Bye. Have a good weekend.